Welcome to our channel. Today, we will discuss an exciting topic that affects millions of people worldwide: diabetes. Join us as we explore interesting facts about this condition. To help us reach more people and raise awareness about important health topics like diabetes, please subscribe to our channel and hit the like button if you find this information helpful. What is diabetes, and how does it affect the body? Diabetes is a condition where the body cannot produce or use insulin properly. Insulin is a hormone that regulates glucose levels in the blood, which is used by the body for energy. When the body doesn't produce enough insulin or becomes resistant to insulin, it can result in high blood glucose levels, leading to various health problems that can range from mild to severe and affect various organs, including the eyes, kidneys, and nerves. Moving on, what are the different types of diabetes, and how do they differ? There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease that usually develops in childhood or early adulthood and requires insulin injections for management. Type 2 diabetes is a chronic condition that develops when the body becomes resistant to insulin or doesn't produce enough of it. Gestational diabetes occurs during pregnancy and usually resolves after delivery but can increase the risk of type 2 diabetes later in life. Understanding the differences between these types of diabetes is crucial for proper management and treatment. What are the symptoms of diabetes, and how is it diagnosed? Symptoms of diabetes can include frequent urination, increased thirst and hunger, blurred vision, fatigue, and slow healing of wounds. Diabetes can be diagnosed through blood tests that measure blood glucose levels or by measuring A1C levels. Early diagnosis and treatment are crucial for managing diabetes and preventing complications. What are the risk factors for developing diabetes? Risk factors for developing diabetes include being overweight or obese, having a family history of diabetes, leading a sedentary lifestyle, and having high blood pressure. Other factors that can increase your risk of developing diabetes include high cholesterol levels, being over the age of 45, and having a history of gestational diabetes. People of certain ethnicities, such as African Americans, Hispanics, and Native Americans, are also at a higher risk for developing diabetes. Having one or more risk factors does not necessarily mean that you will develop diabetes, but it's important to be aware of them and take steps to prevent or manage diabetes if you have any of these risk factors. Moving on to the types of diabetes again, we'll cover the symptoms and treatment options. Type 1 diabetes occurs when the immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes typically develops in children and young adults, and people with type 1 diabetes need insulin injections or an insulin pump to manage their blood sugar levels. Type 2 diabetes is the most common type, and it occurs when the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Treatment for type 2 diabetes typically involves making lifestyle changes, taking medication, and monitoring blood sugar levels. Gestational diabetes occurs during pregnancy and usually goes away after the baby is born, but women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Lastly, what are the common symptoms of diabetes? Common symptoms include increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, and slow wound healing. However, some people with diabetes may not experience any symptoms, which is why it's essential to get tested for diabetes if you're at risk. People with type 1 diabetes may also experience increased hunger, irritability, and mood changes, while those with type 2 diabetes may experience numbness or tingling in the high levels of sugar in their urine. If you're experiencing any of these symptoms, it's essential to talk to your healthcare provider and get tested for diabetes. Early diagnosis and treatment can help prevent complications and improve your quality of life. Moving on to our final question: what are some tips for managing diabetes? There are several lifestyle changes you can make to manage diabetes, such as maintaining a healthy diet, getting regular exercise, and monitoring your blood sugar levels. It's also crucial to take any medications as prescribed by your healthcare provider and to attend regular checkups to monitor your condition. If you have type 1 diabetes, it's essential to manage your insulin levels carefully to avoid high or low blood sugar levels. People with type 2 diabetes may also need to take medications to help manage their blood sugar levels. In addition to these lifestyle changes, it's important to make sure you're getting enough sleep, managing stress, and avoiding smoking and excessive alcohol consumption. as these factors can also affect your blood sugar levels. Finally, it's crucial to work closely with your healthcare provider to develop a personalized management plan for your diabetes. This plan may involve regular blood sugar monitoring, medication adjustments, and lifestyle modifications to help you manage your condition effectively. Thank you for tuning in to our discussion on diabetes. We hope you learned something new and valuable today. Don't forget to subscribe to our channel and hit the like button if you found this information helpful. See you in the next video.